The Tennessee Medical Association is a volunteer nonprofit advocacy organization, and much of the work that we do is in advocating for bills, both that help patients and also that try to limit restrictions on what its member physicians are able to do. Currently, we have 6,800 members, and there are about 10,000 physicians practicing across the state. So roughly about half of the physicians, or a little more than half, are actually members. We have a whole bunch of different programs. One of the first programs that came out of the Tennessee Medical Association was our malpractice insurance group called SVMIC, or State Volunteer Mutual Insurance Corporation. Back in the 70s, all of the private insurers left the state, and physicians were kind of left scrambling. And SVMIC was of work in addition to providing malpractice insurance. Obviously, they're very concerned about lowering risk and physician safety. So that's a group that's provided a physician training and whatever now for a number of years, even before the opioid epidemic came along. We also have the Tennessee Medical Foundation, which was started by the TMA and was spun off as well. Dr. Michael Barron spoke earlier today about that for physicians that have developed some kind of an impairment issue. We've done CME. The CME for opioid prescribing for the 2-hour course has been available to physicians across the state, both members and non-members. We also have a very interesting, if you go to Tennessee Medical Association website, and you type in the word opioid, it pops you into an opioid page of resources. And the resources are all sorts of interesting things. A sample pain agreement, a page on proper prescribing patterns. There was an issue of the Tennessee Medicine Journal looking at opioid risk. So this opioid resource center has all sorts of very interesting information. Tennessee state laws summarized in a fashion that's understandable, and as they're updated, because things change and little sections of laws change. So they've done a lot with advocacy. We have a very active advocacy group that's worked on appropriate cutting down on opioid prescriptions at the same time without unnecessarily burdening practicing physicians with too many restrictions. So that's kind of the bottom line in that. There's posters, a lot of more things that are on that website, which is really a fine website. Even if you're not a physician, it's worth looking at. You can't access all of the information if you're not a member, but there's a lot of information there you can access, either members or non-members as well. So we're obviously the Tennessee Medical Association is very involved. And I think our goal is twofold. Fold number one is let's protect the patients, and fold number two, let's not overly restrict the ability of physicians to practice medicine. So in a nutshell, I think that's probably the major issues. I'm certainly more than happy to answer any questions.